Bismillahirrahmanirrahim. Hello friends. Today we will discuss about one of the complications of facial nerve injury known as Bell palsy. There is a clinical representation of the unilateral facial nerve Bell palsy. You walk their scenario. You woke up one morning and your face feels stiff and odd. When you look in a mirror, half your face appears to droop. You can only manage half a smile. Your eye is dripping tears and does not want to close. What is the world? What in the world is going on? Charles Bell, well known for his study on the nervous systems and the brain, in the 19th century discovered that lesion of the seventh cranial nerve causes facial paralysis because it controls the innervations of the facial muscles. What nerve was that again? The seventh cranial nerve is paired with the structures that travel through a narrow bony canal called fallopian canal in the skull. Beneath the ear to the muscles on each side of the face, the nerve is mostly encased in a bony shell. Facial nerve. Each nerve controls eye blinking and closing, facial expressions, smiling and frowning, tear gland, salivary gland, muscles of small bone in the middle of ear called the stapes, test sensations. There is a diagrammatic representation of the innervations of the muscles, glands, eyes, chest by the facial nerve. Clinical sign suggesting site of facial nerve lesion. Upper facial territory is supplied by bilateral motor cortex. Lower facial territory is supplied only by contralateral motor cortex. Therefore, unilateral central regions spare upper face. Lesion distal to the geniculate ganglion, mostly motor abnormalities occurs. Lesion proximal to the geniculate ganglions, motor, gustatory, or autonomic abnormalities can occur. Classification. Sunderland classification of nerve injury. We have first, second, third, fourth, and fifth degree of damage. In first degree of damage, compressions of the nerve only occur. In second degree of damage, interruption of exoplasms occurs. Third degree of damage is disruption of myelin sheath. Myelin sheath is a lipid membrane which isolate the nerve from the other nerve. Fourth degree damage, disruption of perineurium, myelin, and axons. Fifth degree of damage is transections of the nerve. If we cut the nerve like so, it's occurred in the fifth degree of damage. Bell palsy, characterized by periapical peripheral facial paralysis, acute benign cranial polyneuritis. Acute disorders characterized by a disruption of motor branches of cranial nerve 7 on one side of the face in absence of the stroke. Sign and symptoms varies from person to person. Come on suddenly, mild to total paralysis, weakness, twitching on one of the both sides of the face, facial and eyelids droop, drooling, dryness of eye and mouth due to the supplies of the salivary glands, impairment of taste, excessive tearing of the eye. Other signs of symptoms are pain or discomfort in the jaw and behind the ear, ringing in one or both ear, loss of taste, headache, hypersensitivity to sound, because it also supply the stapedius muscles of the inner ear, impaired speech, dizziness, difficulty in eating and drinking. Clinical manifestation often accompanied by an outbreak of the herpes vesicles in or around the ear, pain around or behind the ear, fever, tinnitus, hearing deficits, flaccidity of the affected side of the face with drooping of the mouth accompanied by drooling, DT paralysis of the facial nerve. Only motor branches are affected. Inability to close the eyelid with an upward movement of eyeball when closure is attempted. Lower lids may be turned out. White palpebral fissures opening between the eyelid. Flattening of nasolabial fold. Inability to smile, frown, and whistles. Unilateral loss of taste. Altered chewing ability. Loss of or excessive tearing occur. There is a diagrammatic representation of the woman with the facial nerve rejuvenation on the one side and the symptoms of the Bell palsy on the other side. Bell palsy is smoothing of the forehead, like there is atonia. There is no supply of the nerve to the facial muscles. So there is atonia of the muscles. There is no tone in the muscles. So the muscles droop. Inability to close eyelid, drooping of the mouth corner. House Brackman grading systems. Grade 1 is normal. Grade 2 is mild dysfunction, slightly weakness on close inspection, normal symmetry at rest. Grade 3 moderate dysfunction, obvious but not disfiguring difference between sight and eye can be completely closed with effort. Grade 4 moderately severe, normal tone at rest, obvious weakness and asymmetry with movement, incomplete closure of the eye. Grade 5 severe dysfunction, only barely perceptible motions, asymmetry at rest. Grade 6 no movement occur. Topographic diagnosis. To determine the anatomical level of periapical lesions, lacrimal lacrimations at the level of geniculate ganglion, Stapedius reflex, motor nerve of the stapedius muscles. Test cotta tympani. Schremer's test. Geniculate ganglion and petrosal nerve functional test. Schremer's test. Screamer's or Schremer's test. Positive when affected sites show less than half of the amount of the lacrimation seen on the normal site. Sum of the length of wetted filter paper for both eyes less than 25 mm. Lesion at the proximal to the geniculate ganglion is confirmed with the Screamer's test or Schremer's test. Stapedius reflex. Nerve to stapedius muscles test. Impedance audiometry can record the presence or the absence of stapedius muscles contraction to sound stimuli of 70 to 100 decibel above hearing threshold. An absence reflex or a reflex less than half of the amplitude is due to lesion proximal to the stapedius muscles. Test. Electrogastrometry. Coda tamponite nerve test. Solution of the salt, sugar, citrate, quinine, or electrical stimulations. Compressed amount of the current required for the response of the each side of the tongue. Normal. Difference is smaller than the 20 UMP. Threshold difference by more than 25 is abnormal. Total lack of coda tympani, no response at the 300. Disadvantages: false positive is the acute phase of Bell palsy. There is a diagrammatic representation of coda tympani diagnosis test. What causes this? It occurs when the facial nerve is swollen, inflamed, or compressed. Due to these, the facial nerve injured. because of injury to the facial nerve, Bell palsy occurs. So, what the causes of the damage? Mostly unknown, maybe due to neoplasms, maybe due to idiopathic cause. The mostly unknown cases are maybe caused by a viral infection like viral meningitis, herpes simplex virus, like influenza, headache, chronic air infection, high blood pressures. How high blood pressure can cause Bell palsy. If there is a high blood pressure, so the chances of a stroke is high. So the brain damage occurs. If the brain damage occurs, so the nerve may be damaged. So by these ways, sarcoidosis, tumor, Lyme disease, trauma. Who can get this? Affect 40,000 American search years, men and women equally affected. There is no any ratio of the there is equal cases of the ratio between men and women. Can occur at any age, mostly affect 15 and before 16 years old patients, occur more often in people who are pregnant, diabetic, and have upper respiratory infection. Complication: psychological withdrawal, diabetes, DT, changes in appearance, malnutrition or dehydration, mucous membrane trauma, corneal abrasion, muscle stretching, and facial spasm and contractures occur. Diagnosis: how we diagnose Bell palsy. There are no specific lab tests to confirm diagnosis. Will exam for upper and lower facial weakness. Electromyography confirm presence of the damage and determine severity of the damage. MRI or CT scans causes of the pressure on the nerve. Treatment: there is no real treatment for the facial nerve injury. Symptoms usually subside. Only the treatment is given to subside to decrease the sign and symptoms. Anti-inflammatory or antiviral like prednisolones is a corticosteroids and acyclovir is antiviral, increase the chances of recovery of the Bell palsy patients. Acupuncture and surgery for long-term paralysis. Treatment: hard to close eye, use and eye patches, eye drops, trap eye shut when sleeping. Therapeutic management: corticosteroids, drug of choice, prednisolone may be started immediately. Best if initiated before paralysis is completed. Taper off over 2 weeks. Decrease edema and pain. Analgesic may be needed for pains. Antiviral like acyclovir and famivir because herpes simplex virus is implicated in 70% of cases of Bell palsy. Outcome is good. Total recovery depends on amount of damage to the nerve. Improvement is gradual. Usually start to get better after 2 weeks of onset. Most recover completely within the 3 to 6 months. In a few cases, the symptoms may never completely disappear. In rare cases, the disorder may be reoccur either on the same on or the opposite side of the face. Thank you very much. Stay safe and stay home. Thank you.